You have tested positive for the COVID-19 virus. It's important to take care of yourself while you are sick. There is no specific treatment for the virus that causes COVID-19, but we recommend you rest, drink plenty of fluids, and take acetaminophen to reduce fever and pain. Please note that these medications do not cure the illness and do not stop you from spreading germs. If you are not having symptoms, you are still able to spread COVID-19 to those around you. Please seek prompt medical care if you experience serious symptoms such as difficulty breathing, vomiting, dehydration, or confusion. People with life-threatening symptoms should call 911 and tell dispatch personnel that you have COVID-19. If it's not urgent, call ahead before visiting your doctor. You may be able to get advice over the phone. After you test positive for COVID-19, you may be asked to provide information to Public Health and Human Services about your close contacts. People in your house, your intimate partners and caregivers, as well as people who are within 6 feet of you for a prolonged period of time are considered to be close contacts. Because these close contacts have been exposed, it is possible that they could test positive for COVID-19. They should self-quarantine even if they feel well, because it can take up to 14 days for them to show symptoms. Please begin making a list of those you are in close contact with. This will help Public Health and Human Services to notify them quickly and reduce the risk of spreading COVID-19. While you are infected with COVID-19, it's important to prevent the disease from spreading to people in your home and your community. You must restrict activities and limit all movements that may put you in contact with others during the quarantine period. This means staying home. Do not go to work, school, or public areas. Arrange for food and other necessities to be delivered and left at your door. If you cannot make arrangements for someone to assist you, please call 211. Do not leave your home except for medical care. If leaving for medical care, do not use public transportation. If you should have a medical emergency, you need to notify 911 first responders or call ahead to the emergency room and tell them you have been exposed to a confirmed case. This will allow them to prepare for your care. Do not allow visitors and separate yourself from others in your home. You can do this by staying in a specific room and using a separate bathroom if possible. If you must be around others in your home, open windows and shared spaces if possible to ensure good airflow. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. Wash them thoroughly with soap and water after use. You should wear a face mask at all times when around other people in order to prevent the spread of the disease. Face masks should not be reused. If you are unable to wear a face mask for any reason, then the people who live with you should not be in the same room with you. If they must enter your room, they should wear a face mask. Once leaving the room, hands should be washed immediately before and after taking off the mask. In order to prevent the disease, it's important that you cover your mouth and nose with a tissue when you cough or sneeze, and clean your hands often. Use soap and water for at least 20 seconds when washing your hands. If these are not readily available, clean your hands with hand sanitizer that contains at least 60% alcohol. In addition to these things, it will also be important to clean and disinfect all high-touch surfaces every day. Examples of surfaces include countertops, doorknobs, and phones. Diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common EPA-registered household disinfectants should be effective. Follow manufacturer's instructions for application and proper ventilation. Isolation for COVID-19 can be lifted when all of the following criteria are met.
You have had no fever for at least 24 hours without the use of medicine that reduces fever, and other symptoms have improved, and at least 10 days have passed since your symptoms first appeared or since your test date if you have not had any symptoms.
Being in isolation can be stressful. We recommend doing anything you can to keep in good spirits while in isolation. This includes keeping in touch with family and friends via phone, email, or social media, keeping up normal routines when possible, and exercising when able. Visit como.gov/coronavirus to learn how to care for your mental health and support your loved ones. If you need to speak with someone about your mental health, contact your doctor or the Burrell Behavioral Health Crisis Assist Team at 800-395-2132. If you have any additional questions during this time, visit como.gov/coronavirus for more information and guidance. Please call your primary care provider for any questions related to your health. If you need help finding a healthcare provider, call the state hotline at 877-435-8411.